talkative patient, if you keep on facilitating the history and encouraging them to talk, then you'll find quickly that this approach does not actually work for talkative patient. And you need to actually adapt your consultation to manage talkative patient in a different way. We're going to cover the common challenges that registrars are facing with the RCA. Common challenges that registrars are facing with real-life consultation is that patients are coming in with multiple issues. A lot of patients have saved a lot of their problem, and when they come or consult doctors, they're coming in with a list of problems. So this is a challenge that a lot of registrars are finding, that they're having to address this, and they have like a strategy to deal with that. We're going to cover this. Another common challenge is that patients are coming in and talking a lot, so they're going on and on about things. Your time is ticking, and you're feeling stressed because you're not able to complete everything within 12 minutes. The other challenge is time management. So time management is a big problem for many registrars. Registrars are finding that still within 12 minutes that they're finding it difficult to complete everything within these 12 minutes. I'd like you to remember that when the RCA was first started, the registrars only had 10 minutes. So now that you have 2 more minutes, you need to actually use that more strategically, because examiners are expecting more from the clinical management because you have more time to do it. Multiple issues. Can you think about patient coming in with multiple problems? How are you dealing with these problems? So a patient coming with low mood, back pain, they're also feeling tired. Have you got any strategies that actually you can implement when patients are coming in with these multiple issues? Because if you don't have a strategy how to deal with that, then you get flustered. You don't really know how to manage things. And sometimes I've seen registrars trying to manage 2 or 3 problems in one consultation for the RCA. If you think about it, you've got only 12 minutes to deal with a problem. And if you're trying to deal with 2 or more problems, you won't be able to deal with it safely, because you're not going to have a good management for each of the problem, because you only have 12 minutes. So it's very important that you manage expectation of your patient, and you know what are the things that you'll be dealing today and what can wait, and you need to prioritize what you're going to deal with your patient. We're going to touch on to how you can do that later today. The other problem is talkative patients. When you're asking a question, they're telling you so many things, and you don't get the opportunity to actually move the consultation forward because they're talking about things that are likely to be irrelevant, and you're getting frustrated. So think about how you're dealing with that. Have you got any strategies, what you're doing when patients are coming in and consulting with you and taking a lot of your time? How do you do it? Do you interrupt them? What do you do? First thing I'd like to say is that, for example, if you see a patient who's talkative, ask yourself why the patient is talkative, because there are reasons why patients are talkative. When you can find out what's the reason the patient is talkative, then you can address it. You've been probably trained how to actually consult in terms of patient-centered consultation and facilitating the history with the golden minute. That's very good. And that's something that I'd still encourage you to do within the first couple of minutes. However, for talkative patient, if you keep on facilitating the history and encouraging them to talk, then you'll find quickly that this approach does not actually work for talkative patient. And you need to actually adapt your consultation to manage talkative patient in a different way. And the first thing you need to do is find out why a patient is talkative. So there are 3 broad categories as to why patients could be talkative. The first one is relational. If a patient is talkative because of relational cause, this is probably one of your patients who is living on their own and has not spoken with anybody during the pandemic. So they are coming in or they are consulting you over the phone, and they have a human being to talk to, and they want to connect with that person, tell them their problem. And if you know that's the problem, why they're talkative, because they're on their own, they're feeling isolated, then you can address that problem. So if you try to actually talk to them, connect with them, listen to the problem, and understand them, then it's likely that you'll be able to build that rapport with them and consult them and manage them appropriately. Because sometimes what happens is that if you don't know what's the reason, you try to over-medicalize the consultation and you try to do more test investigations, and this is not going to stop them from talking. What they want to do is to connect with somebody and to talk about their problem. And sometimes this process of listening to them is therapeutic for the patient. So if you know the patient has a relational cause of talkativeness, you can address that. The second cause is if a patient is emotionally talkative. So this is the patient who can be anxious or nervous. So they're rambling about a lot of things because they're very nervous about coming to the doctor and they're talking a lot. So this type of patient, what you need to be doing is that you need to put them at ease. You need to make sure that they're comfortable. When they're more comfortable, when you're consulting them, they're less likely to be rambling about things and talking a lot, and they will be at ease and you'll be able to consult with them. The last cause of talkativeness is personality. Some people are just talkative by nature. You need to have a strategy how you can communicate with them. We're going to touch on to what sort of strategies you can implement if you have a patient who has a personality of being very talkative and talking about a lot of things. So another challenge is this poor use of time. So many registrars find it difficult to transition to clinical management. What they're doing is that they are dwelling on data gathering and taking a chunk of their time and leaving only 4 minutes for clinical management. And when this happens, what they do is that they don't give themselves enough time for clinical management. And there's no surprise that they don't do well for clinical management. If your time management is not good, then it affects on every aspect of the consultation. It affects you on your interpersonal skill because you're going to rush and you won't be able to listen to your patient and you won't be picking up on relevant cues. It's going to affect on your clinical management because there will be steps in your clinical management that you're going to miss or you're going to rush through, and it's going to affect the whole consultation. So make sure that you've got your time management under control. Make sure that you're tracking your time, and these are the 3 criteria I'd say that I've noticed that if you can work on these 3 things, then you're likely to make sure that you're keeping good time within the consultation. Make sure that your history is focused. There's no need that you go through every question because there are so many questions that you could ask if you have more than 12 minutes. But what's the point of asking non-essential things? Because the point of the RCA is to show the examiners that you're a GP who can actually practice as a safe and independent clinician. It's not about actually asking all the questions and showing that you know all these questions that you need to ask. What you want to be doing is to keep your history focused, to make sure that you're not going through other things that's not relevant, and non-essential things that you're covering won't score you marks. It's actually going to impact on your clinical management. So make sure that your history is focused. By focus, what I mean is that cover what's essential in the history to make sure that you have a safe assessment. So things that you need to be covering are making sure that you've got a good medical history as to the presenting complaint of the patient. Make sure that you rule in and rule out serious pathologies. That's why you need to be using your red flags. And when you're doing that, make sure that you don't go through a checkbox exercise. Try to do it naturally. The conversation needs to flow with your patient. And ask them what's their health agenda. So you need to be asking them about their ideas, concern, and expectation. When you're asking about their health agenda, make sure that you ask it in context. Don't just ask this question out of the blue, so that it becomes something that's natural. Also make sure that you cover the psychosocial aspect of the history. By doing that, you can actually know what's the severity of the presenting complaint on this patient's work and life. So make sure that you have a focused history. Keep it focused. Don't go and ask about other things that's not essential for the consultation. Another thing what I've seen is that the registrars who summarize so many times that they become repetitive. Try to avoid using summary excessively because you're just wasting time. You don't get marked for summarizing. The other hallmark is that to make sure that by 6 minutes you transition into clinical management. If you manage to do that, then you give yourself enough time for clinical management. So if you're trying to dwell on data gathering and you don't come into working diagnosis, what you find is that you end up being still in data gathering by minute 7, minute 8, and there's still questions that you want to ask. And what you're doing is you're procrastinating, committing to working diagnosis and moving forward. So make sure that you try to do that. You'll find that you're managing your time better if you try to do that. The other thing I would say for you to experiment is that while you have 12 minutes for the consultation, try to give yourself a constraint. Try to do the consultation within 10 minutes. See whether you can do it. By doing that, then when you scale it back to 12 minutes, you'll see that it's more feasible for you to do it within 12 minutes when you put a constraint of 10 minutes and experiment with that. It might sound counterproductive at first, but try to do it and you'll see how easy it becomes when you do it 12 minutes. So that will help you to have a good use of your time. Throughout the consultation, you'll be confident because you have a good track of your time and you have your good interpersonal skill building rapport with your patient. So what I'd like you to do now is to think about some strategies you've got, how you're managing when you're seeing patients with multiple problems, when you're talking with patients and you find out that they are talkative, or that when you're running out of time, what you're doing. Have you got any strategies that you can implement? Because without strategies, you can actually do all the hard work, but you're going to get the same results. So it's very important to work on the strategies, how you implement them, and improve your consultation as you go through this RCA. The advantage of the RCA is that it's a dynamic examination. You can get better. So for the RCA, the beauty of that is that you can iterate and reiterate and keep improving. So the way you can improve it is by getting constructive feedback, by making sure that you're analyzing your consultation and implementing strategies. So that will help you to get better at consulting. Strategies to actually deal with patients who are talkative. We're going to cover that now. You need to take a step approach. So as we talk about patient-centered approach, this is what you need for most patients. However, for talkative patients, sometimes you'll see that one side doesn't fit everything. So you might need to adapt your approach and take a step approach. You need to make sure that when you're talking with your patient, if you're interrupting your patient, make sure that your patient doesn't lose face. You don't want to come across as somebody who's abrupt. You need to do it in a way that shows compassion and supportive to your patient. Another thing that you can implement is to share responsibility with your patient. So we'll look at each of these in more detail now. When you first start your consultation, it's very important to have an open question approach where you're asking open questions and try to elicit the history so that you get the patient's side of the story. So use open question. And the golden minute, which is in reality 2 minutes, is that you're getting the story from the patient. So avoid interrupting them in the first couple of minutes, because what you might do is that if you interrupt them, you're asking question. What happens is that you might have to ask more questions to get the whole story because you've interrupted them. So make sure that in the first 1 minute, 2 minutes, don't interrupt them. Then if you find out as you go through the consultation that you're asking questions, the patient is telling you things that might not be relevant or they're going off a tangent, then you need to adapt your question, reformulate your question, try to clarify things, and ask more close-ended questions. And what you'll find is that if you're asking patients open questions, you're giving them the opportunity to tell you a story. They might take 20 seconds, they might take 1 minute to answer. But if you ask them a closed question, or if you give them an option, then what happens is that you limit that to 20-second answers. So the other thing is You need to make sure that when you're doing your step approach, you need to make sure that your patient doesn't lose face. So the first thing you need to do is to build up credit. This is a concept that clinicians talk about, where they build up credit is the best thing that you could do to make sure that your patient build rapport with you is to listen to them. So many registrars don't actually listen actively. When you're listening to your patient, they will appreciate what you're doing. They will appreciate that you're giving them attention, you're listening to them, and you're showing understanding. So when you do that, and then what you do afterwards is that you build enough rapport with them and trust, then you can interrupt them because they know that you've been listening to them. And then if you have to interrupt them, if you find that they're talking a lot and it's not helping the consultation, then when you interrupt them, it's going to help you because you've built enough credit with your patient. And when you interrupt them, make sure that you do it in an empathic way. So if you're going to interrupt them, you need to show that you're empathic and in your approach. So, for example, if you're going to interrupt somebody, you might say to the person, I understand that this is important to you, but let's come back to this problem, which is why you came here today. I'd like to know a little bit more about this. So by doing that, you're actually showing that you understand them, but you want to get to the problem that they came in with. So you're showing to the patient that you're aligned with them to help them solve the problem. And the reason you're interrupting them is to help them to get to the bottom of the problem. So that's very important to have this alignment with your patient when you're interrupting them, so that they know that you're on the same team. Once you interrupted them, then you redirect the conversation to where you want it to go. So make sure that you understand this concept that you don't want to have the patient to lose face. So you can use that to actually navigate the consultation, especially if you have talkative patient. You can interrupt them a couple of times and see where the consultation goes. So the directive approach is something that you can use for patients who are talkative and you might find that the other approach is not working. What you could say to your patient is that, for example, a patient presenting with multiple issues, you might say to the patient, you mentioned a few issues at once. I'd like to go back to the real reason for your consultation. Coming back to your knee pain, Mrs. Smith, could you tell me what have you tried to make it better? So what you do is you rein back control of the consultation and you direct the consultation back on track. And if you do that a couple of times, most patients, what they'll do is that they'll go back to the real reason why they came through. And the other thing about multiple issues is that if you're having to deal through multiple issues, make sure that you assess for it in the beginning of the consultation. What you don't want to do is to consult a patient with a knee problem and then at minute 9 or 10 they tell you about their chest pain and it just come out of the blue, because then you'll have to assess whether this is something that you need to address in priority. So what you want to do is to share responsibility with your patient. Remember, for the RCA, it's very important that you involve your patient, and you can't actually be showing that you're only doing what the doctor's agenda is. You need to make sure that you're addressing the patient's need and you're consulting with your patient as a partner. So how you do that? You need to make sure that your patient is also responsible for effective use of time. So for example, if Mr. Smith is coming with multiple problems today, you need to have this discussion with Mr. Smith at the start of the consultation about, I understand that you've got multiple issues today. We're going to try to manage what we can, but I think it's important that we talk about what's the most pressing problem today. So prioritize the most urgent problem and reach a consensus with your patient about which problem that needs to be addressed today. And let the patient know that the other problems are important and we ought to give sufficient time to deal with the other problem. And unfortunately, we may not be able to do that today, but it's important that we give them enough time. So I'd recommend that we book another appointment. But what you can do is that after the 12 minutes of the RCA, you can deal with the other problems afterwards off camera. So that's how you would deal with multiple issues. So make sure that when you're dealing with multiple issues, from the start of the consultation, you actually have this conversation with your patient, because then you're already managing the expectation that we might not be able to go through every problem today, but we're going to look at what's the most pressing problem. And by doing that, you're showing to the examiner that you're managing multiple issues and you're using your time appropriately. What you don't want to be doing is try to manage 2 problems or 3 problems in 12 minutes, because it's unlikely that you're going to be doing that well to the standard of the RCA. If you found this video useful, then I've got another video I'm sure you're going to get a lot of value from. This is a video where I interviewed Dr. Caroline Asher, who recently passed her RCA first attempt. We discussed her process, her approach to the RCA, what she wished she knew, what she'd done differently, and you get a lot from this interview. Click on the video to watch it, and if you'd like to have the RCA blueprint, then click on the link down in the description below. Take care everybody, bye bye.